Saludamos especialmente al director del Centro de Modelamiento Matemático de la Universidad de Chile, Héctor Ramírez, al profesor Eduardo Vera, coordinador de vinculaciones externas del Centro de Modelamiento Matemático. Saludamos también de forma especial al doctor Yuj Inoue, miembro del Comité Industrial de nuestro centro, a profesoras, profesores, estudiantes, amigas y amigos que hoy nos acompañan. Damos la bienvenida también a todas las personas que están conectadas al streaming de nuestro canal de YouTube, CMM Chile. Desde ya agradecemos a los nuevos suscriptores y los instamos a enviar sus preguntas y comentarios. Los CMM Data Days son una serie de eventos organizados por el Centro de Modelamiento Matemático de la Universidad de Chile para conocer, contrastar y difundir los grandes desafíos de la ciencia de datos en la sociedad moderna. Hoy, Maurizio Arienzo, CEO de NovaWare Inc. e integrante del Consejo Asesor Industrial del CMM, les presentará a ustedes la charla El Hospital del Futuro. Antes de ello, quiero invitar a entregar unas palabras de bienvenida a la 9ª edición de los CMM Data Days al director del Centro de Modelamiento Matemático de la Universidad de Chile, profesor Héctor Ramírez.
Gracias, Cristian. Hola a todos, autoridades presentes, autoridades hospitales del Ministerio que nos acompañan, colegas, investigadores, estudiantes, amigos y amigas. Como bien dijo Cristian, hoy nos encontramos para la 9ª edición de estos Data Days que hemos retomado después de haberlo hecho las últimas ediciones de manera, digamos, telemática y no presencial. Es por lo tanto un hito y estamos felices de que vuelva a ser así. Este es un evento que representa la convergencia entre la ciencia de datos, la tecnología y en este caso un tema asociado a la salud, ¿cierto? En esta ocasión tenemos el placer de presentar a Maurizio Arienzo, que es un referente en cuanto a innovación y un pionero en emprendimiento tecnológico. De hecho, unas pequeñas palabras sobre Maurizio, que voy a intentar resumir muy brevemente su gran carrera. Es doctor en Ingeniería Eléctrica de la Universidad de Brown, en los Estados Unidos, y ha fundado varias empresas relacionadas con Internet de las Cosas y inteligencia artificial. De hecho, cabe recordar que el segundo Data Days que el CMM organizó, realizado 3 años atrás, fue realizado por Maurizio en estos temas, IoT y inteligencia artificial. Bueno, como se indicó también, Maurizio ha sido parte del Comité Industrial Asesor del CMM desde su creación en el 2008. Es un comité que entrega una guía internacional en lo que respecta a tópicos industriales y dirección de nuevas oportunidades de innovación y transferencia para el centro. De hecho, esta semana, justo con Yuri, están participando en este comité industrial y bueno, agradecemos por lo tanto doblemente la participación de Maurizio tanto en ese comité como en este Data Days. La experiencia y conocimiento de Maurizio son invaluables para entender el panorama actual y el futuro de la atención médica, y eso se va a ver reflejado en su charla. Sin ánimo de hacer spoiler, contarles que Maurizio va a contarnos su visión de los últimos acontecimientos sobre el programa Medicare de Estados Unidos. También nos va a compartir su visión sobre el Hospital del Futuro. Según él, probablemente se alejará del concepto tradicional que tenemos como centro médico centralizado, ¿cierto?, pudiendo transformándose en una red de servicios descentralizados, digitales y centrados al paciente. Desde hace muchos años en el medio se comenta que esperamos que la atención médica evolucione a una experiencia más personalizada, enfocada en el bienestar y no necesariamente en la enfermedad. Y sin duda que la ciencia de datos y el modelamiento matemático son pilares para que eso ocurra. Esto permitirá mejorar la información, el flujo de información que es necesaria para seguir mejor la trayectoria de un paciente, pero también, por supuesto, va a aportar con nuevos modelos, con nuevos algoritmos, con nuevos enfoques para mejorar diagnósticos, tratamientos y apoyar las decisiones médicas. Desde el Centro de Modelamiento Matemático, CMM, hemos estado trabajando para la incorporación de inteligencia artificial, modelamiento matemático, ciencia de datos, para mejorar la gestión de hospitales públicos, entre otros problemas de interés. Es así como nos hemos enfocado en este último tiempo, especialmente en la salud pública, creando importantes interacciones y colaboraciones con hospitales públicos como el Hospital Pediátrico Dr. Luis Calvo Maquena y el Hospital Clínico de la Universidad de Chile. Estamos comprometidos a impulsar innovaciones que permitan un acceso más eficiente y efectivo a la atención médica de todas y todos. La charla que vamos a ver hoy día y el trabajo que hemos realizado en estos años por el Centro de Modelamiento Matemático, espero que ofrezcan un futuro prometedor para la atención médica, donde la tecnología y la innovación deberían jugar un papel fundamental, ¿cierto? Espero entonces que esta charla de verdad los inspire a seguir explorando posibilidades que la tecnología puede ofrecer para mejorar la salud en Chile. Muchas gracias.
Agradecemos entonces al profesor Héctor Ramírez por estas palabras de bienvenida y le damos un aplauso más, por favor, al profesor Ramírez. Muchas gracias. El Centro de Modelamiento Matemático de la Universidad de Chile, en su 9ª edición del CMM Data Days, tiene el honor de presentar a ustedes a Maurizio Arienzo y su charla El Hospital del Futuro. Durante este viaje científico, el CEO de NovaWare Inc. e integrante del Consejo Asesor Industrial del CMM, mostrará los sorprendentes cambios que tendrían en las próximas 2 décadas los recintos de salud con instalaciones descentralizadas, impulsadas por datos, centradas entonces en los pacientes y potenciadas por la inteligencia artificial generativa. Damos el anuncio al público presente y a quienes nos acompañan a través de YouTube. La conferencia a continuación se desarrollará en idioma inglés. Invitamos adelante a Maurizio Arienzo. Un fuerte aplauso, por favor. The floor is yours.
Muchas gracias, Cristian. Gracias a todos por invitarme. Es mucho gusto de estar aquí. Yo hablo inglés ahora. Okay, so thank you very much, everybody, for Hector, Christian, and Eduardo, and the CMM team. And it's great to see some very faces that I've seen many times. And you know that I think I went back, except for the period of because of the COVID. I have not given a talk here, but I've given quite a bit of talks telling you everything that I've been doing. So some of you already know some of the things I'm going to be talking about. But I think this is an incredible opportunity. It's kind of a confluence of many things all happening at the same time. And so it's very appropriate. And when Eduardo invited me to come to the Industrial Advisory Board, I immediately told him, I said, Eduardo, I think I can put together several things that have happened in the last few years, and it's going to be a very interesting, talk. So there's not a lot of new things, and probably you're familiar with them, but I wanted to really give you a little bit the big picture of what's been going on. So just a quick introduction. I know that many of you know me already, but I have a PhD from Brown University as a Fulbright Fellow, and then I spent many years at IBM at the Watson Research Center. And then I've had 8 startups, and 3 or 4 of those are in the medical space, so I'll talk a little bit about them today. The last 10 years I've had 2 focuses. One has been in medical devices and medical application, and then in parallel also been doing a lot of Internet of Things. And in fact, right now I'm actually spending more time on Internet of Things than on medical for a set of circumstances, although I'm invested in many companies in that space. And I've had many collaborations in Chile. I mean, it's a pleasure to see some of my friends, Mauricio Contreras, some of you that have spent time with me in the States in some of the startups, because we have had the collaboration of people going back and forth. And it's a pleasure always to come back and visit with all of you. And as already Hector said, I've been in the board of the Industrial Advisory Board since 2008. So I wanted to introduce, I think that what prompted me to decide to give this talk is the first few slides I'm going to show you about what happened to the US Medicare spending. I mean, this is an article that just appeared on the New York Times, and I'm going to show you some of the New York Times research that was done on this, because I think it's really a telltale. I did not know that this has been going on. This is new news. In fact, they have not interpreted the data yet completely, but it's very interesting. So that will set the stage for the two things I'm going to talk about. I'm going to talk about what is the role of AI in the hospitals in, sometimes, in the next 15, 20 years or so. And it's an opinion, but please understand that, I think there is a lot of things that have been talked about AI. And there is a lot of things that people are nervous about, that the AI is going to replace jobs, this and that and the other thing. I'm going to show to you that AI is not replacing any job. It's just going to help everybody do a better job at what they're doing today. And that's what the focus is going to be. And that's what I'm going to show you. In particular, then, I'll show you the next section, the medical devices that I've been developing and we are shipping and so on. That this is part of democratizing medicine. That is the talk you probably have seen me give in the past. But I will repeat some of that, because in the contest, then, you will see that those three pieces will all flow together. And I'll give you some conclusions, or my conclusion about this. So let's start from the first point. The annual Medicare spending. This is medical spending. Sorry. It's if you can see here, this is the amount of money that per person, per individual. Back in 1983, this is from the New York Times, I'm sorry that's small, but the annual Medicare spending per beneficiary in 1983 was $4,422, and Ronald Reagan in 83 said the need for action is clear. Healthcare costs are climbing so fast that they soon threaten the quality of care and access to care which Americans enjoy. We go in 1995, so about 10 years, the amount is almost doubled. And so Medicare trustee in 1995 warned prompt, effective, action is necessary. We are about $17,649 per beneficiary. Sorry, okay. In 2011, so 10 more years have gone by, Barack Obama says, if you look at the numbers, then Medicare in particular will run out of money and we will not be able to sustain that program no matter how much taxes go up. This is 2011, $13,159 per beneficiary. Those are big numbers. Now, if the rate had kept up, the dotted line would show that today, in 2023, we would be at $22,000 per beneficiary. That's a lot of money. In fact, I mean, if you think, I'll show you these numbers are great. But what happened actually is something completely different, that the numbers flattened out, okay? And this is good news because you can see it stayed at 12,495, pretty much up and down around that for the last about 10 years. Instead of being at 22,000, that's basically, so the difference here is $10,000 per beneficiary. And this number, this gap here, is about $3.93 trillion gap. It's amazing, it's a huge number. So the New York Times here tried to explain what $3.9 trillion is, and this 85% of what was spent for COVID in the United States is 5 times all military spending, 6 times Walmart revenue, and so on and so forth. It's a huge number, okay. Now, fortunately, we didn't have to have our taxes increased to meet, to meet this. Okay, now, as I mentioned, these numbers have been collected very recently. New York Times did an incredible job at putting this together. And I was not aware of, and I thought, really, wow, this is amazing. So what are the possible reasons? And those are possible reasons from the New York Times. And I just put a couple of comments on that. First point, Americans appear to having fewer heart attacks and strokes, a likely result of effective cholesterol and blood pressure medicine that became cheap and widely used in recent years. I mean, you go at a certain age, the doctor will tell you, take some statins and some blood pressure medicine, no matter what is your cholesterol number, what is your thing. And it's not just because the drug company can make money with that. It's actually because it's been proven that they've been very effective. Effective at what I call prevention. Now, I don't like prevention by taking a drug, okay? But I don't know if I can convince millions of Americans to do some of the sports that I do. You know, I bike and I swim, but you know, we cannot pretend that people do that much after a certain age, especially. But I think that this is an important thing. You know, focus on prevention. It's really essential to really for what has been going on. And I don't care that prevention for many people has been based on a drug. But second thing is that drug makers, surgeons haven't developed as many new blockbuster treatments recently. A lot of the cost was for new drugs that were introduced and that were very expensive at the beginning, you know, and that's not been going on. There was actually, the truth is also there were some laws that curbed some of that. So the spending was controlled by some laws. And finally, very important, parts of the system appear to have become more efficient and more care is shifted outside the hospital into cheaper settings. This is a lot also been influenced by COVID. You know, people didn't want to go to the hospital anymore. You know, they wanted to go to the little place next door. And New York City, I live in New York City, has exploded. I think right now there are more care places than Starbucks coffee shops. You know, it's like, you know, almost every corner you find the CDMD or one of these stores. That has happened in the last, you know, since COVID, basically. They actually exploded because of COVID, because everybody wanted to be tested and tests were not available. But that really led me to this discussion about the hospital of the future, because I think that this decentralization, as also Hector said, it's an important trend that we really need to understand how to help that, how to make that happen. So I'm going to talk about again, the role of AI, and I insist, I want to repeat one more time that, as you will see, the role of AI is not to replace jobs, it's really to actually make sure that everybody does a better job of what they're good at. What happens is that by 2040, artificial intelligence will be able to access multiple sources of data to review patterns in disease, and aid treatment and care, okay? Now, there is a very important thing here that we were talking actually with the group at CMM that is doing data. The sources of data they're not just at your doctor, at the hospital. Those are gonna be in your Apple Watch, you know, in your apps, in your phone. I mean, it can be in a number of different places. So how to access the data is a really very important data problem, because it's not just that you just go into the hospital and look at my data for my tests. It's much more than that. You really want to understand everything that is been going on, and you have to reach this. It's kind of like almost the same kind of complexity, probably with less politics, at doing you know, the digital state, whatever, how you call it, digital government, that's right. It's that kind of level complexity, because data is distributed everywhere. Second thing is that, so the healthcare system will be able to predict the individual risk of certain diseases, suggest preventive measure. Now what you're doing, you're not dealing on the individual experience and expertise. You can go and the individual that you're gonna deal with is gonna be able to access, or the doctor, the nurse, whatever, is going to be able to access the global knowledge. Is going to be able to access the knowledge that has been collected in the world, sorted and filtered in a certain, hopefully, in a perfect way, to really make sure that the choices that are being made for your treatment are the best choices for the collective knowledge in the world. As engineers, you know, we know that we have access to a lot of information. And when you know, sometimes I feel that I go to a doctor and I have to rely on that person's experience and expertise and knowledge for making a decision about me. I'm not sure that I'm that comfortable, you know, when indeed we are used to access information, you know, on Google and everywhere from everybody, you know. But the important thing is to sort it and make sure that it's proper. Finally, there is this logistic thing, and you guys at CMM have already been working on that. But that becomes very important because the health system now is much more distributed and understanding how to do that. So I actually had this slide before I knew that you were talking about, you had the project that's called the digital twin of a mind, but in a sense it's the same thing. Our digital twin is before a patient is at the hospital, appropriate staff will already have reviewed and analyzed the data, which could include health records, information on medical devices, vital signs from wearables, and scan for diagnostic procedures. That's a challenge. That's a really key thing that if we nail it, we really can do an incredible job. New tests and advanced algorithms will help make faster and more accurate diagnosis, recommend optical treatments, and monitor patient outcomes. That's really the opportunity that we have. And again, this is a support system. It's not replacing anybody. It's really helping make sure that we make much more educated, and more, educated decisions. Finally, the platform have to be of use in helping medical professionals analyze the data in real time, track the recovery after, for example, post-operation or post-events. So there are really three pieces that I can put together. One point is AI-powered predictive healthcare networks. They're helping reduce wait times, improve the workflows, and so on. AI-augmented clinicians are using the tools to enhance their skill in such as surgery, radiology, pathology, dermatology, everywhere. And finally, there is this AI-enabled patient empowerment. I think that, I remember that the first time that I went to a doctor and I told him that I did a Google search and for something that I was feeling, and the doctor really looked at me, you too. It was like they didn't like it. He didn't like it that I had done a search, that I knew something, But I think that we wanted to put the doctors to be even in better position of a search that I can do with Google. They should be able to access this information. And so it's empowerment that is allowing us to, patients to access the data, communicate with the healthcare team, receive guidance and support, and also manage chronic conditions, prevent diseases that I think is very, very important. And prevention is you saw, it's really a key element for cost savings in the Medicare and so on and so forth. So all those things are really very, very important. Now, I'm gonna wanna talk about this AI-enabled patient empowerment as I lead into the next part of the talk, where I'm gonna talk briefly about the devices that I've been working on. And again, some of you have already seen it, so I'll move fast through that. But I call it this is what I call is the democratizing medicine. And I think I gave a talk on that title the last time that I was here. But democratizing means that you put your health in your hands. Is the best way to extend the lifespan is to catch diseases early. And all the devices I'm gonna show you are all centered around this point, catch the disease early. And to us, I come from a family of medical doctors. I think that the best thing is that, make sure that these activities that I've been doing in this space are really opportunity to save the life of people we love. Two months ago, I was in Italy, and my wife had a terrible attack, and it was basically, she had an intestinal strangulation, and it was terrible. It really very hurting, throwing up, and so took her to the hospital. She had 2 years early in the same hospital an appendectomy. And so the same doctor saw her the next day and said, I think we have to operate. I saw the CAT scan, and the CAT scan indicated that it is a strangulation, but I don't trust the CAT scan. So it's a teaching hospital in Florence. And so he gives the keys to his office to one of the students that was there with him. The student ran to his office, came back with a portable ultrasound device. And I told him, checked, and he said, I think now I can see. I only trust myself when I see it with the ultrasound device, with portable ultrasound. let's go, I'm gonna operate. And it was a brittle that was attached, strangulated. I told him, you're my idol. You made my, my career, because that's exactly why we did this. What we did, we developed an ultrasound on a chip. This is a CMOS chip. It has 9,000 programmable transducers. It's not piezoelectric. It's little silicon drums that vibrate. There are 3 wafers stacked together. On one wafer, we have all the circuits. One wafer is at the drum, and then the third wafer is on top to form the membrane that vibrates. Because, so basically there is a transducer and there is a control electronics. What happens is because you have programmable transducer, there's a number of things you can do. The first thing you can do is that you can change the frequency. Change the frequency means that you can basically have one device that can do everything, can do from the carotid and jugular that are really very shallow, all the way to bladder and the heart and the liver and everything else. And of course there's Doppler effect and everything. But also you can beam, and you can move the beam, and I'll tell you in a second what we have been doing with that. But basically, so instead of having this whole contraption with these 4 things are 4 different transducers, as you can see here, they're all different piezoelectric frequency. Here instead, you just select the frequency that you want, and you can go to any frequency in between. Now, the interesting thing, this thing is $2,000. I mean, when we launched it, I think it's a little bit more expensive now. But there's a whole bunch of things you can do. One thing is that actually this was a Bill Gates Foundation that funded us for doing this work here, the acquisition assistance. And this was for Africa. I mean, Bill Gates is really hot about, bringing some technologies to the third world. Now, it takes about, a doctor takes about 2 weeks worth of training to be a good sonographer. But what we can do is that we can number one, this is with AI basically. The system goes and tells the doctor where to rotate the device so that it points in the right direction so that you can take the right scan. And also supports the interpretation. So basically, you can have somebody that is not necessarily a sonographer, not necessarily trained properly, but they can use this device very effectively, okay? Now, again, this is not, but what we can do also is that we can do, let me go back a second here because it doesn't like to go back, okay. You know that when you have an operation, no, you may not know, but you have an operation, sometimes you have to stay in the hospital about 3 more days because you have to make sure that you're urinating, that you have enough urine. We're sending people home with the device. We're sending people home with the device so that they put the device on their bladder, and automatically the beam is formed, it scans the bladder and calculates the amount of urine that is in the bladder. That information goes automatically to the doctor so that then the person can go home with the device for 3 days, 4 days before and save a lot of costs of keeping the people in the hospital. There is a lot of other things that we're doing, guiding, when you put the needles in, you can guide them automatically and so on. It's all that, it's ultrasound that learns, basically. We have a cycle of telemedicine, deep learning, and the devices that allow us really to do all of these things. So AI, again, is helping using the device and applying. This is an example, here with Brown University at Kenyatta National Hospital. But and this is kind of like, you can see, this is a pregnant lady, and this, if you see the face of the baby. Something interesting is that they were telling me, some of these people that were in Africa, that there was the shaman originally that would come put their hands on the pregnant woman, and they would talk about the baby. Well, when they learned that these things was there, nobody went to the shaman anymore. Everybody wanted to go to the butterfly doctor, the doctor with the butterfly. All right. Next device that I worked on is looking into the eye. This is the fundus of your retina, and you won't believe how much information is there. It's really amazing. So started a company, and there is an unmet they need. I mean, ophthalmology is really weird in a sense that I go and get a checkup, and they check everything. They check my ears, my throat, my nose, but they don't check my eyes. And you have to go to a separate person, ophthalmologist. And people don't go to the ophthalmologist that often. So 80% of vision loss could be prevented if it's caught early, but people don't go to the ophthalmologist. And by the time you know that you have a problem, it's too late, okay? So, and 34% cardiovascular could be reduced to identify high-risk patients, and early identification Alzheimer's could really improve quality of life. Now, all of this information is available, actually, on the fundus of the retina. So we developed a piece of equipment that is actually portable. It's like a binocular, and you can basically look at not only to ophthalmology diseases, you can look at the fundus of the retina for diabetic retinopathy and all these other things that is done now normally, routinely. And there are some countries that are more advanced than others that to do screening with that. That is critical, is key. But also we can look at vitals, blood counts, cardiac conditions, infections. We can look at safety risk and detective hypertension because we can see white bloods, we can see perfusion, we can see a number of things, inflammation, and early detection of this. And again, this is a device that learns. The data is sent to the cloud, can be annotated by a doctor through the web app, and comes back. And the reason this is one of the crazy things that is going on. And I know that in Chile, you don't have as much strict requirements for FDA like we have in the States. But the crazy thing is that because this device is portable and is used by the user, okay, they could not grant us the clearance before we did a user interface. So we had to first go through testing where there was a third person, another person present, because their certification requires, in this space, requires to have a technician present, okay? And so we had to do all user interface experiments with FDA. So we had a much more tough, pathways to get clearance than a regular boxy, big ophthalmological diseases that has all these techniques. Because we have a device that does not require a technician to use it. It's kind of insane. The other device that I want to just briefly talk about is just this Hyperfine. We're doing MR imaging. It's a portable device. It goes on wheels. You can bring it to the patient's bed, or you can put somebody's head, or you can put a baby inside. So again, this is a device that costs $50,000 instead of $500,000 or $1 million. I mean, so again, access to, in the third world, the technology is just amazing. That concludes my talk, and let me just summarize. I think that, by learning from every patient, every diagnosis, and every procedure, as long as we can access all that data the proper way, okay? AI creates experiences that adapt to the professional and to the patient. This not only improves health outcomes, but also reduces clinician shortages and burnout while enabling the system to be financially sustainable. It's incredible, it's amazing. But is it within reach? It's just that it's gonna take a while, I know that. But I'm used to things that take a while. But I believe that, AI most powerful use is to enhance human capability, not to replace them. And so the heart of connected care isn't new technology, it's people. The people we need to be cared for, and the people who work so tirelessly to deliver the care to all of us. I mean, I think it's just amazing, and I'm so excited that to have worked on this, because it's just amazing stuff. Thank you.
Agradecemos entonces a Maurizio Arienzo por esta relevante charla titulada El Hospital del Futuro, que fue parte estelar de la 9ª edición de los CMM Data Days. Más fuerte el aplauso, por favor. A continuación, abrimos un espacio para una ronda de preguntas a Maurizio Arienzo, ya sea para el público presencial y también para quienes siguen el streaming en el canal de YouTube CMM U Chile. ¿Alguien tiene alguna pregunta o comentario?
Gracias, Mauricio, por la charla. ¿Te pregunto en español o en inglés? Ok. Tengo dos preguntas. La primera es si nos puedes comentar sobre la recepción que tiene el mundo médico profesional de estos dispositivos que democratizan el uso por no expertos. Entiendo que aceleran el diagnóstico, pero a veces puede haber diagnóstico errado. Esa es mi primera pregunta. Y la segunda pregunta es si nos puedes comentar un poco más del equipo que hace todo esto posible. Supongo que hay electronics, AI, médico, sales.
I'll answer in English. Okay? So the first question about the reaction and of the medical, the medical. I would say that I've been in computers for many years. Okay, you have whenever we came with a new computer with the new graphics and so on, we always targeted what we call the people that they buy always the latest stuff. For PCs and computers, you have the early adopters. Okay, we identified early adopters in the United States, but they're early adopters. I mean, the masses don't buy the top computers, for gaming and everything else. But those are the important ones that we always served because they are the ones that are the most demanding, that they want the real stuff. So it's a nice coupling because the early adopters are also demanding, and that's what we need to make better products. So we identify some of these early adopters and we work with them. We gave them the devices and they start using them. We had people that wanted to use it in their profession because they felt that the stethoscope was not enough when somebody would come in. People in the emergency rooms, they really, they cannot wait that the person gets dragged somewhere to do an MRI and so on. And having this one around their neck is an incredible opportunity. But of course, the big masses come later. It takes a while, okay? And I think really for all of this to happen, we're going to have to see that some new students are trained with this at school, and then they finally get into the profession, and then it will happen. Until that happens, I don't think it's going to be as generalized. But we can all make a difference in helping it. So the team, what happened that we were lucky because kind of we started doing, we didn't, everybody now talks about AI, but some of this stuff was going on all along. I mean, we have been doing things, we didn't call it AI, so we had good engineers and so on. And then when the situation with AI exploded, now those engineers are impossible to hire because New York City is very expensive and so on. But we were lucky to have an early start. We had very good people, and we still have them because they're very happy to work on this. But you do need very good teams, especially on the AI side, and you have them too here. That's really important because they answer your questions. Okay. Back up.
Una pregunta en inglés o castellano. Bueno, a question about the hospital in 2040. What would it look like? I mean, if you have to look like a picture, it wouldn't be like the huge infrastructure that they have now, of course. It would be several scattered little sites. I
made a reference to ophthalmology before, and India has had a big problem with ophthalmological diseases. And I think that there are two private sets of private clinics, Prasad and another one, I don't remember the name. And they have scattered clinics all over India, these two private. And they have all the equipment that is necessary, and they provide screening for free, okay? That, I think, is an example of what is gonna happen. I think there will be a lot of scattered things where you go and you get checkups, and you get check up everything, not just, also the eyes and everything else maybe. And so that data then gets accumulating. And then you're gonna look, because looking at data points is very different than looking at data trends. For ophthalmological diseases, they're all trends. You can start looking at, let's say, macular degeneration. Macular degeneration is a process that happens over time. And the data point may not tell you anything, but if you look at it over a period of time, then you can see that there is a trend, and you can catch it really early. And it's key. That's we can save a lot of lives for doing that. And so, my take is that my device, I wanted to see in every retirement community so that everybody can go and check themselves up. And then automatically, the cloud will tell, wait a minute, I see something here, go see an ophthalmologist. By the way, ophthalmologists worldwide, there are not enough ophthalmologists for all of us in normal circumstances. Now you add this, there's absolutely not enough ophthalmologists of any kind. So having devices that you can use like this is critical. Otherwise, without those, they won't, you can't take an appointment with an ophthalmologist in New York. It's 6 months from now. I mean, forget it. I mean, it's like too late. So it's a combination of the data, the trends, and the personal devices. That's why I'm saying this whole thing is all coming together, and it's a magic moment, but it will take 20 years or more to implement it. So. Yes, go ahead.
Muchas gracias por presentarnos tu visión. ¿Cuál ha sido tu experiencia tratando de alinear las miradas de la gobernanza, las aseguradoras, los prestadores? Te lo digo, yo soy director de hospital, y cómo generar la transformación interna de procesos que están muy anclados en la cultura organizacional y que cuesta dar esa mirada.
That's a very good question. And so I've been CEO of about 4 medical companies. And honestly, what is the question? Oh, sorry, you're right. The question has to do with what is the reaction of the governance, in general, the insurances, the doctors, and everything, all the infrastructure, basically. And I tell you, I mean, I don't frustrate easily, but when I mean, all these 4 medical companies, I really got frustrated very quickly because some of the reasons that you are asking. It starts, I mentioned before, the frustration with FDA that really sends us in this loop because of user interface. But insurances is another very important point, because now you see that if you go to a hospital and you get this big machine do the test for you, is reimbursed. If you then go with this thing, no, they cannot reimburse you. And so then it comes to the absurdity that the ophthalmologist says, even if this thing is a few $1,000s, I cannot bill for it. Versus if I have instead, buy a $200,000 machine, then I can bill for it. And I said, this is insane. It's insane. So the infrastructure is not ready for this. That's another big problem why it's going to take years. But I think that, and we're all engineers here, more or less, so you understand what I mean. I mean, as an engineer, I go there to try to solve a problem. So I found the problem, and I go for the solution, And the medical is not like that, for plenty of good reasons. I think, as I said, my father was a gynecologist, my brother was a gynecologist, so as I come from a family of doctors, there is so many risk elements and so on. But again, I mean, if we can eliminate these risk elements and all these things, then the attitude is going to change, because then we're going to provide support that is documentable. So now your decision is not your decision. It's your decision with the support of the global knowledge, and therefore it can be justified, and you don't have to be afraid to be sued, for malpractice and all of this thing. But you see, this is not going to change overnight. I mean, it's going to take time, but it's all there. That's your question? Yeah. All right.
Okay.
Hi, thanks a lot for your talk. I'm curious about what is the status of the cybersecurity related to this technology and the related regulations regarding that the private data is not leaked to unwanted parties, and also unwanted people cannot modify the data.
That's a very good question too. Thank you for asking that. I mean, we actually were this today, with the data team. I mean, you have this HIPAA regulation that actually are very tough, very tight. Okay, so that the data cannot be shared and so on. That would be a big complication. But that's why, in the challenge of the digital digital equivalent, that you create, and so on, you have to mix data that is generated by your own portable devices with data that is there, and then you need to have all the security and that control. That's, has to be there. Sometimes it's a hindrance, but sometimes it's necessary. We have plenty of stories. So that has to be all done within those, and that would be another slowdown. We will slow down the application, the use because of that. But it's there, has to be done. I don't know what to say. It is. We were talking about some crazy ideas, for example, that where you can have the retinal scan to become access to your data, so that if you are in an ambulance, they can use that, and automatically they will unlock, because you have authorized that, it will automatically unlock your data to be available to your care team. So even if you're unconscious, you have authorized them to look at your retina and to authorize the use of your data. We have to think about all this situation. As a user, I would not want to be in the situation that, well, I'm unconscious and therefore I didn't authorize my data, therefore they cannot do anything to me. It's insane, So I think we have lots of great ideas that we can use some of this technology.
Thank you, and I'm sorry that my question only be in English, so I hope that you understand. That my question is a little bit the stupid side, from the privacy side, okay? That now the people, it's the people's data, the patient data, but this data should be transferred to some public area and then processed, and AI manufacturer or the medical care guys will be making a lot of profit from that data. So what kind of the demarcation or rule will be introduced in the future?
Very good question. I think this is a good sequel to your question. It's difficult in a sense to try to understand who's going to make money and how. I think the important thing to me at this point, I'm sure there will be rules of regulation on top of HIPAA now to regulate all of that. But what is important to me is that then this happens, so that then if I have something, this knowledge can be applied to me. I don't care who's going to make money about it. I want to be healthy. I want to be well. But it's tough because it's one of these things. It's an entrepreneurship, and so you want people to be able to do this work so that they can benefit from it. Otherwise, nobody's going to work on it. So there's got to be a way for some people to benefit from it. At the same time, you want to make sure that it's done in a regulated way and not in a crazy, insane way where, IoT is just the same thing. My experience in IoT is right smack into this, because IoT, everybody thinks that it's their data. So you have a little guy that sells you a $5 sensor, and they think the data that sensor is sensing is their data. That doesn't make any sense. Okay, doesn't make any sense whatsoever. But on the other hand, if I have a platform and I collect all this data and apply AI to create value for let's say for a cold chain, distribution center, with tags and so on that control the temperature of things all the way from the distribution center to the store, and I create value, I want to be compensated for that. So you see, there is a difference, and I think there's going to have to be some regulation, because otherwise people go crazy about this. But it's going to take some time for everything.
Since that the U.S. is leading in this way, so what kind of the discussion on this? Since that the U.S. is leading in this database, the hospital and patient care. and especially to prevent the health. In this area, that the people are providing a lot of information from the portable wearing the Apple Watch, etc. And then but the people may start to complain about it. So I'm sure that the U.S. discussions going on.
Well, unfortunately, the U.S. is very stiff about some of these things. So one example that I was giving is that for FDA, Chile is a great country because I can come here and I can test the device, versus I cannot do that in the States until it's FDA approved. I mean, so, but it's good. I mean, in a sense, because I gotta really experiment, and if of course I know, but there is risks associated. So it's a give and take. But in the States, what is happening right now, we are much earlier than this. It's still between Apple, data and all these different data. And hospital system, they don't talk to each other. They're all different, and so on and so forth. It's a mishmash. I mean, it's difficult. I think it's the same here. But back to the point that we're discussing of decentralization, okay? And the fact that there's going to be, again, I like very much, I mean, I met with the people in India that did this stuff, and they're really visionaries because, they really thought about a lot of these things. And, they know how to deal with the data, how to deal with the distributed and everything else. There is learning to do. And maybe we can take the best cases from all over the world and apply them, and then hopefully people will listen and will be able to do something right. Huh? Thank you. Thank you again.
Gracias, Mauricio. Bueno, si no hay entonces más preguntas, cerramos este espacio de conversación. Muchas gracias a todas y todos por sus aportes a esta conversación. Y antes de culminar, queremos invitar al director del Centro de Modelamiento Matemático y a Mauricio, doctor Yuj Inoue, y al profesor Eduardo Vera para una foto oficial como miembros de nuestro profesor Inoue. Profesor Eduardo Vera, como miembros de nuestro comité asesor industrial. Mauricio, you can. Perdón, si quieres el modelo. Thank you very much. Muchas gracias a todas y todos por habernos acompañado hoy, ya sea por el streaming del canal de YouTube del Centro de Modelamiento Matemático o acá en el Zócalo del Hall Sur de la Escuela de Ingeniería y Ciencias de la Universidad de Chile. Ahora las y los invitamos cordialmente a disfrutar de un cóctel preparado al final de este salón. Muy buenas tardes y hasta una próxima oportunidad.